Good morning, good morning, good morning. All right, I am so excited to be here. Wow, what a day. So exciting to be here. Um, I just hope that you can hear me and you can see me. I can hear myself loud and clear. I'm excited. We're trying to get everyone to join in. And while we're trying to wait for everyone to join in, I just want everyone to know that it is a pleasure to welcome you. I am so excited. And it is a pleasure to welcome you to this webinar brought to you by Teledoc, an app where we bridge the gap between expert medical advice and everyday concerns. We're so excited, and it's been such an honor to be a part of such a movement, especially at a time such as this. It's been an exciting journey, and we're excited to see the impact and the feedback from people from all across the world. It's been so exciting to see how we're able to bridge the gap between doctors and also people who actually need the help, all from the comfort of their space. All from the comfort of their space. My name is Kiki Okewale, and beyond everything that I do, I am a firm believer that access to the right information can transform lives. Access to the right information can definitely transform lives. Before I go ahead with, my intro, I would just like to welcome everyone, especially our amazing doctors who have been here before time, who made their time available to be here today to impact the world, to be a beacon of hope, to do a free health consultation. This is something that they would ordinarily charge for. But here we are today, giving back to the society. I'm so excited. I see people already joining us from all over. I would please like for you to tell us your name and your location where you're joining us from. If you're joining us on social media on Instagram, we are so excited to have you here. If you're joining us from YouTube, thank you so much for being here. If you're joining us from StreamYard, we're glad to have you on board. We would love to know your name and where you are joining us from. So I know that a couple of people are getting the links as we speak right now. So I'm trying to slow down on my intro to make sure that we have enough people on board. I want to make sure that we have enough people on board. But while we're waiting, please tell us your name and where you are joining us from. I am so excited to have all our doctors here already. So excited to have all our doctors here already. All right, so while I'm waiting for intros, um, please, for those of you handling our social media, if you can please help me drop the social media messages because I'm not sure it's going to show on the screen here. For those joining us on YouTube, it's going to show. But for those joining us from Instagram, I'm going to need you to help me drop the messages here. And I know we have a lot of people joining us from Instagram already. So I'm looking forward to getting the feedback from our social media queens, okay, and kings. We are looking forward to that. All right. Okay. So while we're waiting for intros and letting people know, welcome to Ask the Expert. And we do have the expert here with us today. We do have the expert here with us today. Um, I know you have high expectation as much as we are ready to give you, like I say, we're ready to give you back to back, because I am definitely, we have Mary from France. Hello, Mary from France. Thank you so much for joining. If I missed out on any other name on social media, please kindly drop it again, because I am definitely I just decided to join from my other app so that I can see everyone's message. So If you've dropped a message on social media, on Instagram, please do help me drop it over again. But I have seen Mary's message. We have Mary from France, and I know that we have a lot more people joining us from there as well. All right, so like I said, it's a pleasure to welcome you to this webinar. Just in case you're just joining us, this webinar is brought to you. I, Juliet from United Kingdom. Thank you so much for being here. Such an honor to have you. Good morning, Regina. Good morning. Thank you so much for being here. We are definitely so excited to have you here. Hello, Irene. Irene is joining us from London. Hello, Irene. Thank you so much for joining us from London. We're excited, so excited to have you here with us today. I'm getting pumped up already. We have Deborah joining us from Lagos, Nigeria. Hello, Deborah from Lagos, Nigeria. We have Regina, good morning. We have Irene. I'm popping it on the screen so that my speakers can see that we are not here all alone. My people are here. And I love it when we don't joke with our health. I love it when we show up for ourselves, because really, this is the best time to know everything we need to know about our health. And we're getting free health consultation. I mean, that's a big deal. So you better be showing up for yourself. Please, if you're on social media, help us click that arrow. Send this link to as many people as possible. Good morning, Queen Abike from the UK. Thank you so much for being here. I want you to help me click that link that looks like a envelope. Help me click that link. It will take you to different people that are on your social media. I want you to help me invite as many people as possible. As many people as possible, because this is free health consultation. Like, there's no better place to be right now than this moment. We put it in the money because some of you might have parties you want to go to, and we're like, you know what? How about we sort out your health before you go to that party? Because a lot is definitely happening in the world, and we need to pay attention to our health, to the health of our children, our family members. And that is why we took this initiative also to commemorate and celebrate women for International Women's Day. So this is in celebration of our amazing, amazing women. Yes, we're going to be taking questions from men, from women, about children and everything. But this is TeleDoc celebrating and thanking everyone who has been a part of TeleDoc in the past few months that we have started this journey. It's been an amazing, amazing one. All right, we have Basmail from United Kingdom as well. Dr. Adams, good morning, good morning. Joining from Abuja, Nigeria. Thank you so very much. We also have Fatima from Nigeria. Thank you so much for joining. So grateful to have you all here. All right, so my peeps are here. It's time for us to dive in, because my doctors are ready to give you this free health consultation. If you have your questions, please just get your questions ready. On social media, on StreamYard, wherever you are that you're listening to me, get your questions ready. We are ready for you. All right. So I want you to give us, emojis. Let me know how ready you are in the comment section. Let's, hype our doctors and get them ready. While we're doing that, we're going to play our video for you to see while you're dropping your names and everything. We just want you to know a little bit about TeleDoc so that you can understand exactly what we do and why we are here. All right, so let's have the video. Thank you very much.
I just spent hours at the hospital waiting to see a doctor. Let me ask you a question. Would you rather put on your clothes when you're feeling sick, enter traffic, spend money on transportation, and still wait in line to see a doctor? Or would you rather conveniently pick up your phone, book an appointment with that same doctor specialist from the UK, US, Canada, Nigeria, or anywhere in the world, all from the comfort of your home for as low as 2,000 to 10,000 naira? Of course you would. And we TeleDoc that's exactly what you get. You don't have to waste time, money, or even leave your bed when you're feeling sick. All you have to do is 1. Download the TeleDoc app from the App Store or Google Play Store. 2. Sign up and create your profile. 3. Select the type of doctor or specialist you need. 4. Book a consultation at your preferred time. 5. Connect via video call to discuss your symptoms and receive a diagnosis. And finally, get prescriptions, referrals, and expert medical advice all through your phone. That's it. That's all. No long waiting queues, no next appointment stress, no unnecessary expenses. It's fast, it's easy, and it's affordable. Download TeleDoc today and take control of your health from the comforts of your home.
You heard that, right? You heard that, right? From the comfort of your home, you can consult with specialists, with doctors from different part of the world. It's been a great journey. In the past 4 months now that we launched fully TeleDoc, we have over 3,000 downloads. We have over 600 doctors on the app, and the consultation has been amazing. The feedback has been super great. So how else can you talk about bridging the gap than bringing technology, bringing doctors to your home, to your space, all from the comfort of your phone? All you need is your phone, no long waiting period, no wasting of time, no traffic. All you have to do is from the comfort of your own phone, download the TeleDoc app and consult with your favorite doctors. All the doctors that we're having today are gratefully on the TeleDoc app. We're so grateful to all our doctors. They have been super amazing. They've been impacting the world. Because trust me, you can have money and not have access to even the doctors. These are specialists. These are doctors. These are people that are giving back to the society by using their spare time to also do virtual consultation. So I am so grateful to all the doctors and to all the clients that has downloaded the TeleDoc app, that has consulted on the TeleDoc app. Thank you for making us see, it's been a journey. We must confess, it's not easy to have a startup, but you guys make it worth it. Thank you so much for believing in this vision, and thank you for showing up. And also, in our way of giving back to the society, we have put together a giveaway that we're giving in the next few days. People are going to be requesting for this giveaway, and I'm just going to share with you the video just for you to see what this is all about. All right, can we have that, please? Thank you. 1 million naira giveaway. Yes, you heard that right. Hi everyone, I am Kiki Okewale, CEO of TeleDoc app, and I am so excited to announce a unique opportunity to support individuals and families in need of healthcare assistance. As part of our commitment to giving back to the community, we are launching what we call the TeleDoc Healthcare Support Giveaway. We'll be giving away a total of 100,000 naira each to 10 lucky individuals or families to help cover their healthcare needs, whether it's for surgery, specialist consultation, or treatment for yourself, for your child, for a family member, or a loved one. We want to help. Our goal is to alleviate some of the financial burdens associated with healthcare, ensuring that everyone has access to quality medical attention when they need it most. To participate, download the TeleDoc app on iOS or Android phone, and then follow our social media page at TeleDoc app and post the challenge flyer on your page. Then upload a dynamic 1-minute video explaining your healthcare needs or those of a family member and how these funds would help. Other opportunities are coming as well. Don't forget to collaborate this video with our Instagram page at TeleDoc app. Use the hashtag TeleDoc app, hashtag Teledoc Healthcare Support 2025. Deadline for submission. Our team will then review all entries and select 10 winners based on their stories. Don't miss this chance to receive support for your healthcare needs or that of a loved one. Apply now and share this with those who may benefit from this giveaway. Tell a friend to tell a friend to tell a friend that you know needs this support. All the best. All right. All right. So grateful, so honored to be able to give back to the society. We're so glad every member of Teledoc team, we're excited to be able to give back, even though the journey has not been easy as a startup, but we want to give back to the society. So please do inform as many people as possible that you know needs this support. Thank you so much. All right, so it's time for us to get started because we do not have time. We want to be able to take as many questions as possible. As a matter of fact, I've started seeing questions. I have started seeing questions, so I'm excited. In case you're just joining us, my name is Kiki Okiwale. Beyond everything that I do, I am a firm believer that access to the right information can transform our lives. In a world where healthcare is evolving, technology is making it possible for us to connect with experts, ask the right questions, and take charge of our well being like never before. Whether it's about everyday health concerns, preventive care, or deeper medical insight, today's conversation is designed to give you clarity, to give you confidence, and to answer the questions that truly matter to you. So, to everyone tuned in, this is your moment. Ask, learn, and engage because knowledge, they say, is power, and your health is your greatest asset. I say this all the time. We live in houses, we drive in cars, but honestly, the place we actually do live in is our body. That's where we live in. So we need to take care of our body. And so without further ado, I want us to meet our first expert. I am so honored today to have the pleasure to introduce Dr. Akpewe. So I'm so excited, honestly. And I honestly cannot wait to learn and take away from our wealth of knowledge. So today she's going to be talking on comprehensive strategies and lifestyle changes for managing obesity. This is absolutely important in this day and age. Thank you so much for being here, Dr. Akpewe. It's such an honor and a pleasure to have you with us. Despite your busy schedule, you have made time for us. We are grateful. Thank you so much, ma'am.
Good morning. Thank you so much for having me. Thank you. My parents are here. They have joined, and my auntie has
Oh,
joined from London too. Welcome.
wow.
Thank you, everybody. Yes. So, are they going to share my slides, or should I share it myself? Okay, it's on. Good. So, good morning once again. I'm Dr. Akpewo Gene Eloho Olu. I'm a family physician and an international board certified lifestyle medicine physician from the American College of Lifestyle Medicine. So, I want to talk today briefly on comprehensive strategies and lifestyle changes for managing obesity. Next slide, please. So, this is my outline: introduction, classification, the burden of obesity and the impact on health, modalities of treatment, lifestyle modifications for weight loss, and conclusion. Next slide, please. Okay. Obesity is a health problem in developed and developing countries and is predicted to affect over a billion people worldwide. The prevalence in Nigeria ranges from 20 to 35%. It has a significant economic impact through direct and indirect health costs. It is a major risk factor in the development of cardiovascular diseases, type 2 diabetes, osteoarthritis, and cancers. It is defined by WHO as a body mass index of greater than 30 kilograms per meter square, while overweight is a BMI of 25 to 29. It is defined by the Obesity Medicine Association as a chronic, relapsing, multifactorial neurobehavioral disease in which there is an increase in body mass that promotes abnormal adipose tissue and abnormal fat, resulting in adverse metabolic health effects. Next slide, please. So that's the classification that we've just talked about. So we have normal weight. Normal weight is a body mass index of 18 to 24.9. We have overweight, 25 to 29.9. And then for obesity, more than 30. And then there are different classes. Next slide, please. So this slide has, if you look at this slide, you see some arrows coming in and some arrows going out. So the arrows coming in are just trying to tell us of the predisposing factors to obesity. We have things that can increase a person's risk for obesity. We have genetics, environment, socioeconomic status, eating behaviors, in which we talk about poor nutrition, overnutrition and undernutrition, and then physical inactivity. And so the arrows going out show the health implications. We have insulin resistance, cardiovascular disease, arthritis, cancers, and so on. Please go on to the next slide. So the importance of knowing about predisposing factors is that some people must have realized some people eat a lot, but they are not obese, while some people eat a lot and they are obese. So this means that there are underlying factors to obesity. So in the treatment modalities, we have the three main treatment modalities for obesity, and they can go hand in hand. That means an individual may require the three, an individual may require two, and so on. Next slide, please. So the first thing I would like to talk about is lifestyle modifications, as I am a lifestyle medicine physician. Lifestyle medicine is the foundation for the treatment of obesity, as it is for most chronic diseases. So sometimes when a patient has hypertension, diabetes, you go to your doctor, the first thing they talk about is lifestyle changes. Even if they are going to give you medications, they are going to emphasize that you have to change your lifestyle. So these lifestyle changes can be professionally directed or self-directed. Professionally directed involves a multidisciplinary approach comprising of an obesity specialist, lifestyle physician, dietitian, exercise physician, behavioral therapist, nurses, psychologists, and so on. And then there is self-directed. So the professionally directed might be that a patient went to the hospital for maybe back pain, and as the doctor was talking to the patient, the doctor found out that the patient is obese, and part of the treatment for back pain is weight loss. So the doctor can tell the patient, you need to lose weight, and the patient can go, doctor, what do I do? The doctor will say, I can refer you to another specialty that can help. So that's professionally directed. Self-directed, this same patient might meet a doctor, and the doctor tells the patient, you need to lose weight, and the person takes it upon themselves to drive the goal and say, okay, you know what, I'll eat less, I'll exercise, and so on. So professionally
Dr. Akpewe, are you there?
Okay. Was that a network
Oh,
glitch?
Yes, yes. You were talking about they are basically, yes, they are
Same
basically the same
goals.
goal. That was the last thing we had. Yeah. So
Okay.
I'll leave now. I think you're back. Thank you, Mal.
Okay. Next slide, please. So the first step towards the treatment of obesity in individuals is behavior change. Obesity is a complex disease, as we have seen. It is influenced by certain factors like genetics, environment, lifestyle. But sustainable weight loss and health improvement starts with behavior change. So it has to come from the individual that I want to lose weight, because no matter the help offered, if the person is not motivated to lose weight, it's going to be running around in circles. So, addressing habits, mindset, and daily routine is the foundation of long term success. Changing behavior patterns to accommodate weight loss is the goal. And these patterns are patterns revolving around food and physical activity. Building new habits take time, but small, consistent changes lead to lasting results. Please, can we go to the next slide? So sorry if you can't see this next slide, but this next slide is what I give my patients when we are talking about lifestyle changes. I ask the patients, what do you want to change? Okay, yes, you are obese, you want to lose weight, but what behaviors do you want to change that can get us to our goal, which is weight loss? So most times the behaviors center around food and physical activity, which we talk about as exercise. So they are the behavior they want to change might be, I'll reduce my snacking, I'll stop taking fizzy drinks, I'll eat more fruits and vegetables and so on. Exercise goals that they might want to attain. Okay, I'll be more physically active, I'll look towards increasing my daily step count and so on. So this is just a sheet, a worksheet, in which people can chart their daily or weekly goals and try to achieve them. So we talk about diet. Diet is very important in behavior change. Various diets have been researched and proposed for weight loss. We have the whole food plant-based diet as proposed by the American College of Lifestyle Medicine. We have the Mediterranean diet, the ketogenic diet, intermittent fasting, and so on. The whole food plant-based diet is one that is made up of predominantly unprocessed foods, fruits, vegetables, whole grains, legumes, fruits, seeds and nuts, and excludes or minimally reduces animal protein. So it's usually a subject of controversy because patients are like, should I not eat egg? Should I not eat meat? Should I not eat chicken? But from the American College of Lifestyle Medicine, they have done several researches and found out that minimizing animal protein and minimizing animal fats and eating more of plant protein have a lot of health benefits. So for the Mediterranean diet, it's also a diet proposed for weight loss that emphasizes whole foods, healthy fats. The difference between the Mediterranean and whole food diets is that Mediterranean diet includes a little bit of red wine, includes some lean meat, and so on. But they are emphasizing on basically the same things: foods from their natural sources, cutting out unprocessed, ultra processed foods. Can we go to the next slide, please? So these are just examples of the different classes of food that are being emphasized for healthy living and weight loss. We have fruits, different kinds of fruits. We have vegetables, the ones that are common in our environment: ugu, water leaf, kale, spinach, tomatoes, carrots. We have starchy vegetables such as potato, because vegetables have starchy and non-starchy. So the non-starchy are the greens and all, and the starchy are the potatoes, sweet potatoes, Irish, yam, and so on. Then we have whole grain, things like brown rice and all. Part of the things we de-emphasize are polished rice. Polished rice is white rice because it has gone through a lot of processing and it contains a lot of starch. They've removed the fiber and things that would have made it more healthy. So it's one of the things we de-emphasize. And then healthy fats like avocado, legumes like beans, and so on. For nuts, we talk of peanuts, cashew nuts, but because they have high saturated fat, we talk about limiting their quantities. Please go to the next slide. So this is the whole food plant-based plate recommended by the American College of Lifestyle Medicine. If you look at this plate, you see it's very beautiful with a lot of colors, and that's how we are supposed to eat, really, like the rainbow. You can see purple, green, red, and so on, orange. Each, in fact, each color has what they signify in our health. Each color has what it adds to our health. So half of this plate is what our plate should look like. Half of it should contain fruits and vegetables. The other quarter up there should contain plant protein and then whole grains. But if you're not following the whole food plant-based system, you still have an option of a healthy plate. Your healthy plate should still, at least half of it should still include your fruits and vegetables. And then for those of us that are going to do animal protein, the quarter of the plate should contain animal protein. So we are not looking at a situation where the food contains a lot of animal protein and just one small portion of salad. No, we're looking at the other way around. The fruits and vegetables, whole grains should contain more, and then the animal proteins should contain a little portion. This is because animal proteins are known to contain saturated fat. For weight loss, we need to reduce them in order to reduce, the weight. And then even in terms of cardiovascular disease, diabetes and all, animal proteins have been found to increase the risk of these things. In fact, one study showed that people that ate egg, up to 3 eggs a week, had an increased risk of diabetes. So the American College of Lifestyle Medicine dwells on research. They didn't just come up with these ideologies. They did research, series and series of researches, which are still ongoing, to show that plant-based nutrition is the way to go, both for healthy living and for weight loss. Please go to the next slide. The next slide is a
Hello, Dr. Akpewe. I can no longer hear you. Dr. Akpewe, are you there? Dr. Akpewe, are you there?
hello.
Can you hear me?
Yes, I can hear you.
Okay, I think it's the network. I couldn't hear you again. All right, so I'm going to go backstage and I'm going to try and bring back your slide. I can no longer see your slide. All right. You have your slide on your end, right? I don't want that to delay us.
Yes.
All right. Okay, so I'll just leave the stage. While I try to bring back your slide, you can go ahead, please, with use your slide from your end.
Okay. But I think I need permission because I'm unable to share my screen. Um, okay, so let me just continue because I'm unable to share my screen. I don't know if I need permission for that.
Just go ahead with your screen from your own end while I try to bring you back up here. Just go ahead with what you're saying without sharing your screen.
Okay. So the next
Yes, ma'am.
slide, yes, the next slide is not showing. It's just the pyramid of how we should eat, which we've already talked about. And okay, so we have Nigerian foods that we've already talked about that can help with weight loss. So the general tips regarding diet for weight loss include that a patient should be in a calorie deficit while focusing on nutrient-dense, high protein and fiber foods, limit refined carbohydrates, limit animal proteins, increase fiber, limit white rice, white bread, sugar-sweetened beverages, practice portion control, and staying hydrated, drinking about 2 to 3 liters of water per day. And there is this 20-minute rule of eating undistracted, meaning if we're eating, we should drop our phone, TV, just concentrate on the food. Take time, savor the flavors, chew your food, eat for at least 20 minutes. Studies have shown that most times when you concentrate on your food, you are able to pay attention to satiety cues. Meaning, if you concentrate on your food, you'll be able to know, oh, I'm full. Oh, I don't need to finish the whole plate. I don't need my whole plate to be empty. I'm full. But when you're distracted, you're doing something, you're watching TV, because your attention is divided, you just continue to eat and finish the food. You're ignoring the satiety cues. So that's why there's this 20-minute rule. And then eat larger breakfast and lunch, and then fast after 7 p.m. So, meaning that your last meal, especially if you sleep around 9 p.m. or beyond, your last meal should be at least 2 hours to bedtime. Use specific intentions to change habits, like I'll eat a fruit for snack, I'll stop taking fizzy drinks, and so on. And time restricted eating. Time restricted eating is just like saying I will not eat from 7 p.m. and my breakfast will be from at least 7 a.m., meaning that you have fasted for up to 12 hours. So we're still on lifestyle recommendations. We've just briefly talked about the diet. So another part of lifestyle recommendation for weight loss is physical activity. Physical activity lowers the risk of all-cause mortality, hypertension, diabetes, cancers, and so on. And physical activity should be tailored towards the individual and their capacity. So because I hear a lot of, oh, to lose weight, you have to walk 10,000 steps a day and so on. But it is tailored to the individual. An individual may be handicapped and on a wheelchair and obese and needs to exercise. So you can't tell that kind of person to do 10,000 steps a day. So it is tailored to the individual. And then as time goes on, their capacity can be increased. So somebody that can walk for 10,000 steps a day will start small, 2,000, 3,000, and gradually progress. So it is wrong practice to see somebody or start a weight loss program and tell the person that he must start 10,000 steps a day. No, we build gradually and then, increase. Exercises such as cardio, 150 to 300 minutes per week is recommended, such as brisk walking, swimming, and cycling, or vigorous like skipping and jogging for 75 to 150 minutes. Remember, it is individualized and according to the individual's capacity. It may surprise us to know that physically active obese women have lower incidence of breast and endometrial cancer in comparison with normal weight women who are not physically active. So that means an obese person that is exercising is going to come down less or has a lesser risk of having endometrial or breast cancer than a normal weight person that is not physically active. We have the exercise pyramid.
Okay, when I pop up, it means you have 2 minutes. I think,
Oh,
yes,
we're almost
we've
there.
already gone past your time, so I'll
Okay,
just
so
give
I
you
should
two
just
minutes
quickly
and then
round
I'll
up.
be back. Yes, please.
Okay,
I'll be back up in 2 minutes so that we can take the next doctor because we want to take more of questions and the questions are
okay,
already piling up.
okay,
So I'll be back so that you can round up. Thank you.
okay. So we have exercise for weight loss and exercise recommendations, and then other pillars of healthy living, such as stress management, sleep, positive psychology. They are all part of weight loss management. We have surgical interventions. A patient might require to have a weight loss surgery to be able to, you know, achieve their goals of weight loss. And then we have medications that are making the round. We have the GLP-1 agonist, Monjaro, Ozempic, and all that. Very, very good. They have high remarkable results. They have a foundation on lifestyle modification. So they help individuals to make lifestyle changes, making it easier to comply with sustainable weight loss. I have been on obesity management myself. I have lost over 30 kilograms. And if you can see my slides, I'll be very happy to show you my before and after pictures. I'm available to be consulted on the Teledoc app to tell you what I did, to tell you the lifestyle changes I'm making, and I'm available to coach you on the Teledoc app. Thank you very much for having me. Lifestyle medicine is a foundation for the treatment of obesity with or without medical or surgical interventions. Thank you.
All right. All right. Thank you so much, Dr. Akwewe. I'm so glad the your presentation came back and I'm able to show your slide of your
So
before
my
and
link has
now.
popped up
Wow.
on the screen for you to be able to consult me via teledoc to know how I came about this remarkable change. If you can see in the picture, I look 10 years younger than on the left. I'm still a work in progress, but I'll say I have come a long way from where I was, and I want patients to benefit from this by consulting me on the Teledoc app. Let me tell you all the changes I did, and let's get started. Thank you.
All right. All right. All right. All right. Well done, Dr. Akwewe. Can you hear me now?
Yes, I can.
Awesome. Wow. What a remarkable journey. Wow, wow, wow. I'm so excited. I mean, looking at your picture, I'm like, wow, 30 kg loss.
Thank you.
Definitely, everyone needs to come and, learn more to get more information on how to do this. And we just put up your link on the screen. If you want the link, it's on the screen. We're also going to send it via email to everyone who registered for the webinar so that you can just click it. If you go on the Teledoc app, you can find Dr. Akwe, where we can have messages of people saying, well done, and saying thank you. I, for one, I honestly cannot wait to come and consult with you. Um, yes, it looks like so for me, I'm gonna be the first one to ask the question. When it's time for question, I'm not gonna ask now. I don't want to cheat, but I have a lot of questions, and of course, we're going to take other questions as well. But I can see the feedback from social media and here. Well done, lovely presentation. That's from Irene. Thank you so much, Irene. I definitely enjoyed our presentation as well. But not to worry, get your questions ready, start dropping it. I will show them on the screen. But we're going to have the next doctor now. Thank you so much, Dr. Akwewe. Thank you. You're such a blessing. Such a blessing for a time like this. A lot of people are really battling with obesity, with diet issues, with weight issues. It has become a pandemic. And so this is the right time for us to be talking about this. On social media, TK Gold Collection says, thank you, doctor. Thank you so much. All right, so get your questions ready. Dr. Akpewe is still here. She's going nowhere. We'll bring up our next doctor, and then, we want to compile all the questions so that it makes it easy for us to actually do what? Ask all the questions together. I'm excited. I'm excited. I'm excited. All right. To my next doctor, I have Dr. Afolabi talking about raising a healthy child, nutrition, immunity, and milestone. Did we hear that? Did we hear that? Raising a healthy child, nutrition, immunity, and milestones. I am so excited to have Dr. Falabi with us today. Dr. Falabi, how are you doing? You are muted. Please unmute yourself. Please unmute yourself,
Okay.
Dr.
Hi
Falabi.
everyone.
All right. Hello,
Can
hello.
you
Thank
can
you
you hear
so
me
much for
now?
being here. Loud and clear, loud and clear. Thank you so much for being here. All right, so you have the floor.
Okay. Okay. So good morning everyone. Hi, how are you all doing? All right, my name is Dr. Afolabi Miriam. I'm a pediatrician. I've been in pediatrics for the past 4 years, going to 5 years now. So I'll be talking about three interesting topics, and I hope we can enjoy this topic. So one will be about the essential nutrition for your child growth and development. The second one will be boosting the immunity to prevent common illness. and then the key developmental milestone every parent should track. So these three topics are actually interwoven. They are like from one lead to another, the second lead to the third. So we are going to start by the introduction. So raising a healthy child is a top priority for parents and caregivers. A healthy child is a result of combination of proper nutrition and strong monitoring of developmental milestone. So what is nutrition? Nutrition is about the food we are giving our children. It fuel for growth and development. So now we're talking about the right nutrition we need to introduce to our children. Number one, we usually start nutrition from pregnancy till the child grows into an adult. So children need the right food at the right time to grow and develop to their potential. So the most crucial time for growth, for good nutrition, is during the 1,000 child. You all hear me? Okay, I think I'm back now. Until this child's second birthday. So in the first 2 years of life, breastfeeding saves lives. It shields children from diseases and then boosts brain development. And also, it also guarantees children a safe and nutritious food source. So it is recommended that neonates, that is a child from birth 0 day old to like 28 days old, that's neonate, they are introduced to breastfeeding within the first hour of life, because that is very, very important. That's when they start feeding them, and they should be exclusively breastfed for 6 months and continue for 2 years. But at 6 months, we can now start to introduce our nutrient-dense diet, which comprise a variety of food groups: carbohydrates, the protein, the fat and oil, the vitamins, and minerals, the proper nutrients for children. So the example of carbohydrates we actually need for them, they are grains such as whole and all others, protein, the lean proteins. The lean protein actually help with the building blocks for immune cells. It helps build their immune system, means, and oxidant, which help to support the immune system. That's what I said in the first that was what I said about the topic being interwoven, because healthy, if you eat healthy, it will help with the immune system. So essential nutrients, the healthy fats, they are essential nutrients that help reduce inflammation. So now I'm talking about our immune system. How do we boost this our wonderful kids' immune system? Number one, we talk about the balanced diet, which are the good nutrients, the fruit, the vegetables, the proteins, and all. And secondly, we boost our immune system with having adequate sleep, because it allows repair of cells and regeneration of cells. It even helps them relax their brain, because children, they actually need like 6 to 8 hours of sleep. Then another thing we need to help with their immune system is vaccination. It protects them from serious illnesses. There are several vaccinations we start from 0 year, like when they are 0 year, when they are zero, they can take OPV, hepatitis B vaccine. They can take there are 3 vaccines given to them when they are born. OPV, that's the one they give by mouth, the hepatitis B, and also they give them BCG, which helps to prevent.
Dr. Falabi, the network is really, really bad. I can.
Okay,
Dr. Falabi, are you there?
the network is, yeah, I'm there. Can you hear me now? Hello.
Dr. Falabi, are you there?
Yes, I'm here. Can you hear me now?
Okay, yes, the network is really bad. We're really struggling to hear you. But it looks
Oh,
like you're back now.
so should I
You
continue
can go
from
ahead.
where
You
was
can,
everybody?
yes, please go ahead.
Oh, okay. So children actually need good food. They need good food to build their immune system. Like I said, they need proteins, they need milk, they get calcium from the milk, which help to build their bones. So I'm going on to talk about the children's milestone. It starts from when they are 0, when they are giving birth to. At 0 to 1 year, children put everything in their mouth. That's when they start touching things and all that. Then at 4 months, they sit without support. At 8 months, they can stand. 9 months, they can crawl, and then they have fear of falling also. Those are the physical developments that we see. They also have motor development, which are at 4 weeks, they follow objects. Like when you are passing, they try to they follow the person moving. They follow objects at 4 weeks. They play with toys. So at 5 months, they start putting their feet to their mouth. At 6 months, they can pass the toys and all. Then they have cognitive development also, that they have sensations and movement, assimilation, accommodation. Those are the things they have. They also have language development, which starts at 4 months. They laugh out loud. So at 8 months, they start repeating words you say to them, responding to your calls and all. At 10 months, they call dada, mama, and the rest. So at 9 months, also, they can have stranger anxiety, because when they see a stranger, they recognize this is a stranger, and they start having stranger anxiety. So at 1 to 2 year, they have another one, which we have the physical development. At 13 months, they walk. Some children walk at 13 months, some children walk earlier. So all children are not the same. Some are early boomers, while some are late boomers, but that doesn't mean they won't still grow at their pace, because some children, they have like a family history where their father or their mom didn't start talking or didn't start working at the appropriate age. So you still give those kind of children the ability, or you give them the opportunity to start at their own pace, so you don't rush them. At 18 months, they can change things from their right hand to their left hand. They can climb the stairs. So they develop their motor skills too by kicking and throwing balls. So at 18 months, they can stack three cubes in one place. So 2 to 3 years, they have high activity level. That's when you see them doing all sort of stunts. They try to walk backwards because they know that I can achieve this, I can do this now, and all that. So the nutrition and the boosting of our immune system was the milestone. They all work hand in hand. If a child is given a proper diet at the accurate age, you'll notice that their immune system is very good. And you know, we have like three different types of immunity. We have the innate immunity, which are the natural immunities. We all have our skin protect us from some diseases because it's part of our immune system. Their innate immunity, they serve as barrier and all that. We have the adaptive immunity, which are developed by either immunization, or probably you've been exposed to a particular disease before. So when that kind of infection comes back, your body can fight it, because to that boost your antibodies to fight against the disease. Then we also have a passive immunity, which lasts for just short period of time. Usually, is given from mother to children, from pregnancy to birth and all that, and usually taken from the breast milk also. So the crucial point of development, like I said, is during the 1,000 day from pregnancy until the child's second birthday. The nutrient you give at that particular stage helps to save their lives, boost their immune system, shield them from diseases, and also helps in their brain development. Most mothers, they will tell you that, okay, I don't lactate very well, or probably, okay, my child, if I feed my child now, in the next few seconds, in the next few hours, he or she starts crying for more food. It's because most times you are not doing it right. Breast milk contains every nutrient the children need from birth to 6 months. So what we do is that we aid them to hydrate themselves very well. The mother should take a lot of fluid, because what you take in will enhance your production. Take a lot of fluid, and you do not allow your child to alternate between two breasts at the same time. Allow the child to feed on one, exhaust that one, because most times what comes out first from breast milk is water. The milk is behind. So if you don't allow the child to suck one, to exhaust one breast before putting to the next breast, that means the child is just taking water from this side and water from this other side. And when you take water, just water, you still be very hungry. So you allow, and what we do again is we encourage them to express breast milk. By the time you are expressing, you would have enough milk to give your child. So we start introducing other food like formulas from 6 months, and introduce age-appropriate formulas. We can't start giving a child at 6 months a milk for 1 year. It disturbs their guts, because their guts is still forming. It affects them. Some mother will start feeding their kids pap at 3 months. That's when they start child having constipation, start having abdomen will be bloated and all that. So we should encourage appropriate diet. Our children also need exercise. They can have minimum exercise like walking, swimming. Encourage regular physical activities in them, just to improve their the lifestyle. And we shouldn't encourage fuzzy drinks, snacks. Let them eat all these snacks. You can input fruit, all kind of fruit. And children like colors. Some parents will say their child is a picky eater, so he only likes jams and all that. No, it's not healthy for that child. Play with colors for them. They like different colors. Get apple, get tangerine, get pineapple, different color, cut into cubes, place it in their table. You will see, before you know it, they would finish the whole food and all that. Because all these nutrients, they have what they do. Like I said, the fruit is very packed in vitamins, and it has antioxidants which help build our immune system and help them fight different organisms. So when we start encouraging them to take that as young children, it follows them to their old age also. And it doesn't just take the mother or the father to raise an healthy child. It actually take the community. So a healthy child is a top priority for parents and caregivers. So a healthy child is the result of a combination of proper nutrition, a strong immune system, and monitoring of developmental milestones. Some children are late boomers, meaning some might not start crawling at the appropriate age for crawling. Some might be earlier than they should, but give every child the opportunity to start. And some children have issues during delivery, like they have cerebral palsy, probably because of the perinatal asphyxia, because when they are being given birth to, they didn't cry because they have to take their first breath within 1 minute. That's 60 seconds of life. So if some children didn't take that within that first golden minute, it can affect their brain development. It can affect their brain activity. So those kind of children, some of them come out of it, they have cerebral palsy, which is mild. Some would develop into a more devastating ones. But with healthy nutrition, with healthy diet, give them vitamins and hygiene also. I would like to talk about hygiene because most parents don't know that they should wash their hand after each toilet activity. Please, let's try as much as possible to wash our hands frequently and also encourage those children to wash their hands because all these surfaces, they are exposed to different bacterias, and children, they just touch them, put it in their mouth. The commonest source of infection is through oral because they touch different germs from wherever they play and put in their mouth. So please, we should try as much as possible to wash their hand frequently. And as a parent, let's and okay, can everybody hear me? I think the network was lost.
Yes, the network was lost for a bit. Can you hear me, Dr. Falabi?
Yes, I can hear you now.
All right, yes, the network was lost for a bit. You have 2 minutes to round up now so that we can
Okay.
take questions.
Oh,
We need to
okay.
take the
Okay.
next
So,
doctor. Yes, yes.
okay. So I would just round up by talking about some other immune boosters like the probiotics. Most times you can get our probiotics from milk, from yogurt. Vitamin C is also important. Zinc is important for children also. So let's try as much as possible to make that available in our children's meal and in every food we give to our children. And also, children, they develop emotionally through they have emotional regulations and they have empathy. So we should try as much as possible to make them feel loved because they are our future, they are wonderful kids. And I hope everybody have been able to pick one or two things from this presentation. So if you have any questions for me, you can always ask on the teledoc app. Okay, my link just popped up on the page on the so you can ask any question you have regarding your child health. So I'm available to answer you whenever you ask your question, and hope I've been able to.
Thank you, Dr. Falabi. Wow, 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 wow. What a day, what a day. Like she has said, our link is on the screen. We're going to share the link with everyone. We're going to share the link with everyone. Don't worry. In case it's not clickable on your end, we're going to make sure everyone gets the link both on social media and by email. Okay. So if you're from the social media page you're joining from, just check the link in the story. We're going to be putting everything in the story, including their link, so that you can just click it and it will take it there. Check the Instagram bio for our clickable link as well. All right, but we're going to make sure everyone gets it. Wow, Dr. Palabi, that was super, super amazing. I definitely have me, I have plenty of questions, even me myself. I'm a patient here today. I do have a lot of questions for you. However, I will let us finish with all the doctors so that yes, I can already see questions dropping for you as well. But if you check the IG of Teledoc app on Instagram, you would see the link to all our doctors today. Just click it. It will take you directly to their own profile. It will take you directly to their profile. Okay. If you don't already have Teledoc app, once you click it, it tells you to download the Teledoc app. All right. Thank you so much, Dr. Falabi. We'll bring you back up when it's time for Q&A. We really do appreciate you. Thank you for sharing from your wealth of experience. All right. So that was Dr. Afolabi Miriam. Let me know in the comment section. Let me know in the comment section how the session has been so far. I mean, yes. Um, For me, I believe it's been amazing, amazing. I can see on social media someone is saying we can't hear you. Can you hear me and can you see me? Let's know if the network is doing its numbers. Well done. Yes. Well done, Dr. Afolabi. Wow. I am definitely super duper pumped. And I'm just so excited. So if you can hear me, you probably need to go out and come back in on social media. It's probably your network because I hear that I am good. They can hear me and they can all see me. Okay, that was Dr. Afolabi, and she talked about our children. Our children, they are our future. Raising a healthy child, nutrition, immunity, and milestone. Akiwande says, yes, we can hear and we can see you. Absolutely. All right. For the doctors we've had Dr. Akpewe and we've had Dr. Falabi. If you go on the story on Teledoc app, on Instagram, you would see their link. Please go and click their links. Very, very important. You want to make sure you can also ask personal one-on-one question. All right, so we have a lot of questions for Dr. Folabi already, and we do have a lot of questions for Dr. Akpewe as well. So I'm just going to bring up our next doctor now. So excited. We've had two doctors and we have two more to go. All right, so we have Dr. Pradep ready. And today he's talking about comprehensive strategies and lifestyle changes for managing obesity as well. Such an honor to have you with us today. Thank you so much, Dr. Pradep. I hope I did pronounce your name correctly. All right, we cannot see your face. If you can please share your cam so that we can see your face. Dr. Pradip, you are up. Dr. Pradip, are you there?
Hello.
Hello. Okay, we
Hello.
can hear you
Yeah.
now. Can we see you, please?
Yes. Yes. Hi,
Awesome,
Dr.
awesome.
Pradeep.
Thank you
Yeah.
very much for
Mm,
being here. It's such an honor
yeah.
to have you here with us today. Thank you so very much. So I'm going to go backstage and you're going to have the floor. When it's about 2 minutes for you to round up, I will be back upstage so that you know that you have 2 minutes to round up. Okay? Thank you so
Yeah.
much.
Sure. Thank you. Hello, everyone. Good afternoon. Good afternoon, everyone. I'm Dr. Pradeep Reddy, presently doing MD Pediatrics and practicing pediatrics. And I am also general physician. I'll be looking after all the ages, including the pediatric age group. Today, my topic is comprehensive management of obesity, how to manage the obesity, how to approach and how to comprehensive strategy for the managing obesity. Okay, it is a holistic approach actually, because we have to be uh, to reduce our weight. There should be a holistic approach which will help in combining the health and eating and regular physical exercises and behavioral changes and the sustainable weight loss. We have to concentrate on sustainable weight loss and how we can see the healthy other things. I'll let you know. And once coming to the healthy eating, focus on the whole and unprocessed foods like fruits, vegetables, grains, and lean protein. You can choose these and limit or avoid processed foods like whatever comes in packets, which is sealed and which is preserved for more days. Just avoid that. Sugar, all sugars, okay, and sugary drinks and unhealthy fats. That and all you have to avoid completely. And how to control your portion. Portion means if you take your plate and you have to divide into equal portions like carbohydrate, fat, and then protein and other fruits and vegetables and green leafy vegetables also. you have to include everything in particular portion so that your digestive system will be good enough to digest properly, and it will consume the required amount, and it will calories will be, yeah. Then coming to the other next one is mindful eating. Mindful eating means while eating you have to satisfy the hunger only. No need to, if at all your plate is full and you no need to finish everything, and just uh, concentrate on the hunger. If you are full enough, and just avoid eating. And if you are while eating, if you are seeing the movie or TV, then you don't know how much you are eating. Even though snacks or meals, you don't know. So try to avoid that. uh, just concentrate on the eating only. Just sit on the dining table and try to eat in the dining table. That will help to avoid the excessive eating, and this is called mindful eating. So you have to pay attention to the hunger and fullness of your stomach, and consider the dietary patterns. That means you have to explore when you are getting hunger, and when you are getting hunger, that time only you have to eat, and try to eat more vegetables, fruits, and whole grains. Okay. Next, coming to the regular physical activity, aim for at least 45 to 150 minutes of moderate intensive exercises. Okay, that's like brisk walking, at least 2 to 3 kilometers a day. Jogging and swimming you can join, and incorporate strengthening exercises. Okay, just do at your home only. 2 days muscle strengthening activities, whatever you like, and make physical activity as a part of your routine. Okay, and uh, uh, then start gradually. If you are new to exercise, start at least now, and go for a walk every day, and get exposure to the sunlight in the morning. Okay, and that will help to not only increase your uh, strength of the muscles, it will also improve the vitamin D levels. Nowadays, vitamin D deficiency is very common because no one is getting exposure to the uh, sunlight. Everybody is staying at home, and that will cause further vitamin D deficiency and bone pains, lethargy, easy fatigability, and irritability. These are all the symptoms which is causing not many software employees, they are facing the issue vitamin B12 and vitamin D deficiencies. Okay, and then coming to the behavioral changes, set realistic goals like gradual, sustainable loss of weight. Don't expect you have to lose the weight at least 10 kg in 1 month. Just make sure that you are losing weight at least 500 grams to 1 kg in a month, and then gradually you have to reduce the weight. Sudden loss of weight, large amounts of weight, that is also danger to the body. Okay, and identify the triggers and barriers. Okay, understand what your body needs, and avoid unhealthy eating and inactivity, and be active, and develop strategies to overcome the inactiveness. Okay, just have some uh, hobbies which will help to just like go for walk, and playing chess, playing cricket, or playing table tennis, whatever outdoor games. Okay, and if you are having trouble in this, you can seek the support from your family, friends, and groups are there. You can join in the groups like cycling groups, walking groups, and all, so that you will get motivated, and prioritize your sleep. That is the first thing you have to do, and prioritize the sleep and stress management, and avoid stress. Leave the stress in the office or whatever, wherever you are having stress. You can't change anything. Just search for the solution and avoid the stress, and go for good activities, and promote well-being. Okay, yourself be well-being. And if at all everything you tried and you are not able to do anything, just consult the professional help. Okay, they will help you and they will guide you properly and step by step how to reduce your weight and how to deal with the uh, weight gain also. Okay, so that we'll see further how other complications for with the obesity are like it will cause uh, more weight loss will cause joint pains, knee joint, because our body weight will be bare by the knees and joint pains will be more. And it will cause the dyslipidemia. When coming to the lab test, obesity will cause dyslipidemia, and eventually all the cholesterol which is accumulated in the body will be converted into the uh, unwanted cholesterol, okay, unhealthy cholesterol, that will accumulate in the blood vessels, and they will block the vessels, that will cause to the uh, brain strokes, okay, and myocardial infarctions, and liver, fatty liver, and kidneys also will get damaged. Okay, to avoid these, you just need to concentrate on your eating, how to eat, and how to digest them, and go for walk, exercises, good exercises, and maintain good mental health. Okay, that is the crucial thing which you can do. And if you have any doubts, you can message me. I'll answer. I'll now.
Thank you so much, Dr. Fadov. Can you hear me?
Yeah, I can hear you.
Thank you so very much for keeping to
Yeah.
time. And I'm excited because we do have questions, and I know you want to give us more time for questions. Your link just popped up on the screen. That is the link for Dr. Pradip. If you would like to consult with him on the Teledoc app, is there. And don't forget, you can always click the link on the IG story, so that the clickable link on the IG story for Dr. Pradip. All right, so you'd wonder why we're talking so much about obesity in adults, in children. Obesity has honestly become a global health crisis, often referred to as a pandemic, due to its rapid rise and widespread impact. And the truth is, the statistic is that over 1 billion people, and that's around 13% of adults, are living with obesity. And that is from the WHO in 2024. The trends continue. Half of the world population could be overweight or obese by 2035. I mean, that is a serious, serious, serious problem. Also, 160 million children globally are overweight and obese. And that's why the pediatricians, the doctors are talking about our children, how to make sure we care for them. That's why we've had two amazing doctors talk about this obesity. The pediatrician has also talked about balancing the meal for our children, removing all the kind of food, the fizzy drinks that can affect them. Because in the US, 19.7% of kids between the age of 2 and 19 are obese. And in this part of the world now, in Africa, a lot of us are following through with all the things that they eat. Gone are the days where you see our children looking, they're not looking too big. You look at everywhere now, everyone is looking, it's like we are pumped up with like a balloon. We're all looking so big, we're all looking so, and it's a big pandemic, it's an issue that half of the world could be obese by 2035. It calls for a major concern because it is linked to heart disease, diabetes, cancer, severe issues that can happen when you are obese. And that's why it's very, very, very important that we take good care of our health and we watch what we eat. We don't live sedentary life. We take care of ourselves because cardiovascular diseases, type 2 diabetes, joint mobility. Some people cannot work for so long. Their joints are aching. It reduces lifespan. And so I'm just talking about this in case you're like, oh, why are we talking so much about obesity? It affects fertility. Even in men, it gives low testosterone. I'm not a doctor, but as the CEO of Teledoc, we keep doing research, we keep learning, and we want to know more. It causes pregnancy complications, menstrual irregularities, PCOS. There's a lot that happens with obesity, and it's very, very important that we get more information about it. Erectile dysfunctional, reduced sperm counts. There's a whole lot. So obesity in men and women and children, we need to pay serious attention to it. Even asthma, early puberty, there's a lot. Heart disease. So the doctors are talking about this because it is very, very important that we take care of it. And sometimes it kind of looks like, oh, I'm not big. But by the time you check your BMI, you realize that you're obese. I mean, I didn't feel like I was obese until I checked my BMI. I'm like, oh my God. Oh my God. I don't look like I'm like that. But guess what? I was obese. And I'm working on it. I've lost 8 kg. Yay. In the last 1 month. And I'm excited about that. And I intend to keep doing it. So please, our health is important. Our body is where we live in. We need to take good care of it. All right. So it's been an amazing journey. Thank you so much, Dr. Pradip. Like I said, all the doctors, the link is in the bio, on the story. You can click it so that it takes you to their page. We're going to have our final doctor for the day, and then we will start taking all your questions. I've seen a lot of questions, but now is a good time to start dropping questions for all the doctors that have spoken today. Last but not the least, we are so grateful and honored to have with us the pleasure of Dr. Kingsley Obodo, and is going to be talking about boosting your fertility, what every woman needs to know. Boosting your fertility, what every woman needs to know. Thank you so much, Dr. Obodo. I'll be back on stage 2 minutes before, or if you are done before the time, just let me know you are ready for question and I will come up stage. Thank you so much, sir.
Thank you so much. Thank you all. Thank you all for having me. Thank you, TeleDoc team. Today, I have the honor and privilege to be speaking these few moments that we have on boosting your fertility, what every woman needs to know. I want to start by saying that the woman has this innate ability to produce after her own kind. This is what God has deposited in her, and in all women, and this is what nature expects. Now, for you to boost your fertility, you must know that there are factors that can also be an impediment to your natural fertility. And once you are able to avoid such factors, then you're on the way to full fertility. But it starts by knowing your own being, your makeup, and it starts by knowing your menstrual cycle. The first thing that every woman should know is to know her menstrual cycle. Number one, the length of your cycle, because we know that menstrual length varies. And we know that menstrual length is between 21 days plus or minus 7, 28 days plus or minus 7 days. So it could be as low as 21 days, or it could be as long as 35 days. So if it's shorter than that, or if it's longer than that, then there could be some form of issues that needs to be seen. And also to know that the flow, the menstrual flow takes between 2 to 7 days. It should not be more than 7 days, and it shouldn't be less than 2 days. And I started by making the statement that every woman has an innate ability to produce after her own kind, and that is what nature has put in. And the flow we are referring to is actually the shedding of the lining of the womb, which is what we call menstruation. Somebody once declared or defined menstruation that menstruation is the agony of a disappointed womb. Why is it a disappointed womb? Because nature has put in the womb the propensity to carry babies. And if it doesn't happen in every menstrual cycle, it leads to shedding of the womb. So if you want to say, have you seen a womb crying? Yes. The tears of the womb is the menstrual flow. Is the menstrual flow. So if it's heavier than normal, then there's an issue. Why do I need to know my menstrual cycle? Because we know that in the menstrual cycle, there are points in time where the ability or the possibility of conceiving is actually higher. We call that the fertile window. Now, the fertile window is that period or the window of opportunity where the chances of conceiving is actually higher than every other part of the menstrual cycle. And how do we calculate that? The first thing you should know, once you know your menstrual length, you are able to calculate. Now, the menstrual length is, it starts on the onset of your menses and ends on the day, a day before you start seeing another flow. So in that way, you'll be able to calculate your menstrual length. And we know that ovulation takes place irrespective of your menstrual length. Ovulation takes place 14 days before your menstrual flow. So if you have started your period today, then you can as well calculate that 14 days earlier, ovulation must have taken place. And how do we calculate the fertile window? Number one, we know that once ovulation, which is a one-time event in the menstrual cycle, takes place, it takes up to 48 hours for the oocytes or the eggs to remain in the reproductive tract, after which they get autolysis, get dissolved, and absorbed. Secondly, once there is coitus, the spermatozoa can last within the genital tract up unto 48 hours. So if you calculate 2 days before and 2 days after your ovulatory period, that window of opportunity gives you the menstrual or the fertile window. And how some may be able to know around the period where they are fertile, the most fertile, because we know around the pre-ovulatory period, there is increased estrogen effect on the cervical mucus. And this increased estrogen cervical mucus makes the cervical increased estrogen secretion makes the cervical mucus very thinned out, clear, and very stretchable, what we call the skin Beckett effect. Nature has done it in such a way that that helps to promote the ascension of the spermatozoa. So around that time, you have that discharge, clear discharge that promotes conception. Now, how do I now boost my fertility as a woman? You should know that number one, there are 4 events that occur for there to be conception. 4 events that must be. Number one is that there must be regular unprotected intercourse with the release of healthy spermatozoa. At the same time, the second event is that there must be release of oocytes or ovulation must occur. Then the third event is that these two gametes, the spermatozoa and the oocytes, meet, and their meeting point is in the fallopian tube. Then the third event that happens is that once fertilization has taken place and the embryo begins to develop, this tracks back into the uterus and implantation takes place. At implantation, or what we call nitidation, that is where uh, the cells that are forming begin to release what the hormones we call human chorionic gonadotrophin, or HCG, which is what you test either in the urine or in the blood sample. So in boosting your natural conception, you must know that there are certain events that can affect. Number one, they can affect your ovarian health or ovulation, things that can affect your tubal health. And the third thing is then 2 things that can also affect your cervical health, and avoid those things. I'll start with ovulation. We know that ovulation, I mentioned earlier on that ovulation is a one-time event that occurs. And one of the ways you will know that ovulation is taking place, there are 4 key things that you will know that, yes, 80% probability that ovulation is taking place is, number one, is that you have regular menstrual cycle, your monthly flow is regular. Some may have what they call mid-cycle pain, which occurs around the ovulatory period. Some can be so intense that they know precisely when ovulation has taken place. Again, some may have what they call mild dysmenorrhea, which is mild menstrual pain. Then again, the fourth eh, one is breast fullness and all that can occur. 80% probability that ovulation has taken place in that. But there are key things that can prevent ovulation from happening. Number one is that people who we mentioned, all the speakers have spoken before me now have mentioned about obesity, obesity, obesity. Yes. Extreme weight can lead to irregular cycles and of course anovulation. So we have not only the obese, but even the extreme underweight. So it's a spectrum. So if you are overweight, there's an issue. If you are underweight, there are issues. For obese patients who are, studies have shown people who are extremely obese, especially those who have been diagnosed with polycystic ovarian syndrome, just losing 10% of their body of their weight tends to regularize their their hormones and also regularize their cycles. Number two, apart from weight changes or lifestyle modification and all that, is lifestyle modification. Most of our women nowadays are indulged into smoking and substance abuse. Now, smoking has been shown to affect your ovarian health, and substance abuse has been shown to affect your ovarian health. It not only reduces, studies have shown that people who smoke, women who smoke, they have reduced or lower levels of estrogen. And over time, that can also affect the ovarian reserve. So people who indulge in smoking tend to have reduced ovarian reserve earlier than age. We know that age is one primary factor. As women get older, the ovarian reserve reduces. But women who smoke, who involve in smoking, tend to have reduced ovarian reserve earlier than people who do not smoke. So another factor that can also affect ovarian health is stress. When we say that even as Nigerians, we are under stress every day. But yes, extreme stress can affect ovarian function or ovarian health, which ultimately will also reduce ovulation. So either extreme emotional stress, or even extreme physical stress. So we're talking about exercise, but if the exercise become extreme, that is also a deterrent to ovulation and must be avoided. Then I'm happy that the speakers who have spoken before me have spoken about eating healthy and all that, because yes, we know that certain food can affect ovarian uh, health and inevitably ovarian ovulation. Example of this is excessive caffeine intake. Excessive caffeine intake, alcohol consumption, all those have been shown to affect the uh, ovarian, ovarian functions. So one must avoid it. So how do I boost my ovarian health? Number one is you must live a healthy lifestyle. And we've talked about balanced dieting, eating. Unfortunately, nowadays we have most of our foods are processed food, but balanced diet is the key. Okay, reduce regular exercises, stress management, then again to have adequate rest. Create time to rest, create time to distress yourself, create time to have adequate sleep. The second aspect we talked about is now the tubal health or the tubal factor. Now, because I mentioned earlier on that fertilization takes place in the tube, that means the tube is actually very, very critical in fertility or in achieving conception, because that is where it begins. That is the meeting point. So it must be free of any impediment and it must be functional. But certain things can make the tube dysfunctional, either by blocking it or reducing the functionality of the tubes. And commonest among these is what they call the pelvic inflammatory disease. The pelvic inflammatory disease is actually a bacterial ascending infection that affects not only the cervix, what we call cervicitis, it also affects the lining of the womb, we call endometritis. It also affects also the tubes, which is what we call salpingitis, and also ultimately also affects the ovaries, ovaritis. And the commonest things that can cause pelvic inflammatory disease, number one is sexually transmitted infection. Sexually transmitted infection. Sexually transmitted infection, how do one acquire that? Either by people who engage in unprotected intercourse with multiple sexual partners, or people who, even if they are loyal, they have intercourse with partners who have multiple sexual partners. They are prone towards having sexually transmitted infection. And the commonest of this is the gonorrhea, Neisseria gonorrhea, and also the chlamydia, where they now destroy the lumina, not only destroy the lumina or the functionality of the tubes, but can also cause a complete blockage of the fallopian tube. So, how do you prevent that? How do you now maintain that? You do to in order to maintain or boost your fertility, there's a need to prevent sexually transmitted infection. And how do you prevent that? If you are not ready to conceive, abstain. Abstinence is key. But in the event that you cannot abstain, be faithful to your partner, even to your male partner or to your female partner, or the use of barrier contraceptives, it's advocated. Another causes of even pregnant, pelvic inflammatory disease is where you have treatment or safe abortions. This can not only affect the uterine for implantation, but also can cause infections that can also affect the tube. Or where there are incomplete miscarriages that are poorly or incompletely treated, that can also ultimately affect the tube. So there's a need where you have an incomplete miscarriage, spontaneous miscarriage, to seek expert help to have it sorted out. And for people who have, and the commonest symptoms of pelvic inflammatory disease is abnormal vaginal discharge. Unfortunately, most women, they go to the over once they're having vaginal discharge, they just walk to the chemist. Oh, please give me this so so and so so. I'm having this, and they take that. That is not appropriate. You need to seek the proper help, get proper attention, do the proper test. It could involve doing a high vaginal swab, endocervical swab, to have you tested, and appropriate antimicrobial agents will be administered. And finally, I want to talk about probably the cervical factors, or your cervical factor. Ultimately, also talk about vaginal health. There are certain things that women do that at times can also affect the vaginal health, because the cervix is the gateway to the womb, and you have the cervical mucus as being the custodian of that gateway. So anything that could make the cervical mucus hostile for ascension of the spermatozoa can also affect fertility. So must be avoided. And the commonest thing that some women do that can affect fertility is people who engage in douching. Douching, either you are using water to douche, or you are using soap, or even cloth to douche, because that distorts the vagina and the normal microbial flora of the vagina, and can increase the risk of women acquiring what they call bacterial vaginosis. So, in order to maintain or boost your fertility, there is a need to probably avoid douching. And again, smoking, which I mentioned, not only affects the ovarian health, it also affects the cervical health, because people who smoke tend to have lower estrogen level, and that can also prevent that spin bucket effect I earlier mentioned. Then, lastly, people who experience vaginal dryness and tend to probably involve in use of vaginal lubricant. Some of these vaginal lubricants are actually detriment to the normal, even sperm health, because what they do is they not only prevent, um they kill the sperm. Some of them can also prevent the motility, reduce motility, and also or kill the sperm. So one must, if you must use vaginal lubricant, you must be very cautious of what the ones you use. Take note of those ones that will be labeled as sperm friendly, because some of them are not friendly to the sperm. So when you are using it, any lubricant you are inserting there can not only be causing, apart from, some of them can also distort the normal vaginal microbial flora, but can also kill the sperm. So they're actually spermicidal. Rather than even enhancing fertility, they're actually a deterrent to fertility. So what do you do for people who are experiencing vaginal dryness? What must you do? Okay, there are natural nature has put the natural lubricant, and the source is actually from just 5 7 centimeter 5 o'clock, at 5 o'clock, 7 o'clock position, where you have the Bartholin's gland. Okay, uh, thank you. Thank you, man. So I'm rounding up, man. So where you have the Bartholin gland that produces lubrication. So that it enhances, that's the natural lubrication. And how do you enhance the natural lubrication? Either natural lubrication. So that's ways in order to help prevent the use of lubrication. And if at all you must use lubricant, people have advocated that water lubrication or warm water or water suffices, rather than use agents that can also affect fertility. I think I will stop here. If there's further questions, I'll be ready to take them. Thank you very much once again for having me. It's my honor and privilege to be here once again. Thank you.
Oh, wow. Thank you, Dr. Obodo. Thank you so much. As usual, you gave it to us back to back. And the questions are piled up. OMG. The questions are piled up. Thank you so much, Dr. Bodo. It's such an honor to have you here. I'm going to be bringing, this is Dr. Bodo's link on the screen. However, for you to be able to click it, please go on the TeleDoc app IG page. The link is in our story. So we've put all the doctors and the link on the IG story. We're also going to be sending this to everyone who registered for the webinar. Okay, so if you registered for the webinar, don't panic. We're going to send all the links to you via email so that you can click it and it will take you straight to the doctor's app. If you are watching on social media, you didn't register for the webinar, the link is in the bio and is also on our story, so that you can click the link and consult with any of the doctors. So I'm going to be bringing all the other doctors upstate now. And we're going to start with questioning. All right, question and answer now. It's time for our Q and A. All right, so we have Dr. Akwewe back here. She's dressed, ready to go party. She's ready to go party. so,
Yes, ma'am. I have an event, so I'll soon leave.
all right. So I'm glad we put this in the morning. So I think
Yeah.
Dr. Pradip is out. If he's back, we're going to bring him up. But for now, we have all our doctors. Let me just use this opportunity to say a very big thank you to all our doctors. Dr. Akbere, thank you so much. Dr. Falabi, thank you so very much. Dr. Kingsley Obodo, thank you so, so, so much. We're grateful to every one of you, for the gift of you and giving us so freely. We are so grateful. I'm going to start with the questions that we have from the top so that I don't miss out on any question. All right. So the first question we have is, are there side effects when using medical weight loss drugs or injections such as Monjaro and Ozempic? And does one regain the weight after stopping? I believe this question is directed to Dr. Um, Akpewe. Yes.
Okay. Um, every drug has side effects, but like I like to tell people, this drug is a treatment for obesity and diabetes. So if you look at them side by side, what are the side effects of obesity? What are the side effects of the drug? Which one is in medicine? We like to say benefit outweighs the risk. So the side effects of the drug are mild. There are some serious side effects which have rarely been documented. But the mild side effects like nausea, constipation, diarrhea, vomiting, those ones when they start as they start the drug and they get, it gets better as you go on with the drug. But I like to ask people, comparing the drug side effects to those of obesity, which one is worse? Obesity can put you at risk for so many diseases, including sudden death. Which one is worse? Is it better to take action, or it's better to do nothing, sitting down and waiting for side effects to happen? And then for the weight regain, the drug is like your partner in weight loss management. You do the work, the drug is cheering you on. Okay, so it's cheering you on to make lifestyle changes, which include diet, exercise, and all that. So you need to build on it, learn how to make those changes while using the drug so that when you stop, because you may not, it's very expensive to use for a long time, use it for a short time, get your body into that, weight loss mode, and then continue your sustainable lifestyle changes. Diet and exercise cannot be overemphasized. They are the foundations on which you build on. So, Juliet, consult me on the Teledoc app and let's talk some more about it. Thank you.
All right. Thank you so much. Thank you very much, Dr. Akpewe. There's another question. We have a lot of questions for you, but I'll take two and then I'll move to the next doctor. And if we have time, we'll circle back again. Can obesity affect a person's sex life? Can obesity shorten life expectancy? I believe you've talked about the life expectancy, but can it affect one's sex life?
Yes, both in the male and in the female. Or I believe the person that is asking is a male. So yes, it can affect, because obesity can cause diabetes, first of all, self-esteem issues. Okay, so a man that has obesity will already have, so maybe if he's not married, some self-esteem. Oh, can I go up to this woman, and all that. So self-esteem issues can lower libido and so on and so forth. But things like diabetes, low cholesterol can cause erectile dysfunction. Those are complications of obesity. Diabetes, low cholesterol, heart disease, and all that can cause low libido, erectile dysfunction. So somebody that has erectile dysfunction will obviously have some male infertility. So yes, it can affect even in the women. It can affect because the hormones. There's also a hormonal interplay between the hormone. The doctor that talked on health, female reproductive health, will have more to say on this. But there's an interplay of hormones between the hormones that the body has in excess due to obesity and the female reproductive hormones. That's why sometimes some women get pregnant when they lose the slightest amount of weight. They may have been trying to get pregnant for a while and they see their doctor, they say you're obese, lose weight. And they try to lose weight, and even without assisted reproductive techniques, they got pregnant because there's a lot of hormonal interplay. And then the weight reduction also helps. So Obesity affects both the male, both the female, and can it shorten life expectancy? Yes, it can shorten life expectancy. That's why it's better to do something about it, than to do nothing.
All right. Thank you so very much, Dr. Pere. I think Dr. Falabi is having network difficulties. I'm going to skip a question until she's back here and take Dr. Bodo's question. Dr. Bodo, are you there? I can no longer see Dr. Bodo. Are you there? Okay, I
Yes,
can see
yes,
you now.
yeah.
I can see you now. So the first question for you is it normal to have irregular flow days? I mean, 2 days this month, 3 days another, 4 days another. The menstrual flow is irregular according to this question. And the person is asking if this is normal. Welcome back, Dr. Afolabi. I'll circle back to you. Over to you, Dr. Obodo.
Thank you.
Dr. Obodo, are you there? Can you hear me?
I can hear you loud and clear. I can hear you.
All right. Did you hear the question?
No, I didn't hear the question at all.
All right. Is it normal to have irregular flow days? I mean, 2 days this month, 3 days another, 4 days another. Irregular flow.
Yeah. When I made my presentation, I mentioned that the normal flow is between 2 to 7 days. Okay, so it must not be clockwise 2, 2, 3, 4, 4. So at times it can vary. There are certain things that can make it longer, and there are certain things that can make it a bit shorter than this thing. Because everything, like I mentioned, the menstrual flow is actually the shading of the lining of the womb. Okay, so that is menstrual flow. So, but if you are having a flow between 2 to 7 days, it's still acceptable. So it can be assumed that you're still having a normal flow. But it mustn't be that you must be having, it must be precisely 2, 2, 2, 2 or 3, 3, 3, 3 days every month. But yes, so it's still possible, and that is still part of it. For any flow that is more than 7 days or less than 2 days, then yes, it will be a source of concern.
All right.
That
Thank you
answers the
very
question
much.
there.
Yes, thank you. The next question is, what about someone who is not seeing a menstruation and she's 36 years old? What can she do?
Okay. If you are not seeing your menstrual flow and you are age 36, the first thing that you need to have is, if you are sexually active, you must rule out pregnancy. For us, we always rule out pregnancy. Okay. But that said, if your menstrual flow is more than 35 days or lasting more than, then you need to have a proper evaluation. Okay. There are certain things that can cause either oligoamenorrhea or amenorrhea. Oligoamenorrhea, when you have a flow that is less than lasting more than up to 3 months. But if it's up to 6 months, then that becomes an amenorrhea. Now,
Okay,
there are certain
I'm not sure
causes.
I mentioned the question correctly. The person is 36 years old and doesn't see menstruation.
No, the question is that she doesn't see menstruation. Is it that she has been seeing menstruation before then? Because when you don't see your menstruation, it's two. You can either you primary amenorrhea or secondary amenorrhea. Primary
Okay.
is for somebody who had not seen a period right from beginning. That is another different issue. But for somebody who has been seeing her period and at age 36 it stops, then it needs to be evaluated. There could be some certain issues. It could be from hormonal issues. Is it from the thyroid? Do we have issues with thyroid? Do you have issues with the thyroid gland? Do we have other issues? Okay. Are there other impediments? I mentioned that even the lining of the womb that is supposed to be shed, where there are invasive procedures that causes the womb surfaces to stick together, what we call Asherman syndrome, such women may not even see their period. Some may even following surgical procedures, like even myomectomy, you will have uterine adhesions. Such people may not see their period, but such people need to be evaluated. And evaluation starts by running some detailed history, getting a history from such women, and running the necessary tests. tests like hormonal profile, doing a pelvic scan, to be sure that what we are even dealing is not even polycystic ovarian syndrome and all that. So it's a quite range. For such person, what to do, I will advise you to seek help from a gynecologist that will probably evaluate you and know why you are not seeing your period if you are not pregnant, outside pregnancy, yes.
All right. Thank you so much, Dr. Bola. I would advise this person to have a virtual consultation with Dr. Obodo on TeleDoc app so that you can, share full details, because the question is not totally clear, so that you can have a one-on-one consultation with the doctor. I think that's a better thing to do. Make sure you click the link in the bio of TeleDoc. That will take you directly to Dr. Obodo's profile, and you can book for a virtual consultation. Dr. Afolabi, I'm circling back to you now. You said we can breastfeed a child for 2
Okay.
years. How about people that go to work? Um, that's the question.
Okay. Okay. So what I said about breastfeeding is exclusive breastfeeding from 0 to 6 months. Then from 6 months, you introduce other foods, but still continue giving the breast milk. That doesn't mean you should be giving breast milk as the major food. So what the person can do is, if they are going out, they can express just leave little for the baby at home, and they complement with other foods. Yes,
All right.
complement.
All right. Thank you very much. Your next question is about Bama. All right. So we've heard a lot about some spread for food. We've heard a lot about noodles. And I just want to tie the question together in terms of Bama for children. Even in schools, you see all of these spread companies coming there to talk about, you spread, do this for your bread and all of that. We will even see people selling noodles, partner with schools, program, they share all of this food. Yet we read a lot about, noodles not being, very healthy. If you can just share more light about, like the person said, is it good for our children? Because as we're trying to balance, we know you talked about, giving them fruit, giving them vegetables, all of that. But also, in this age, God, there's just a whole lot going on out there. So, what do you have to say about Bama? I'll just say spread, not necessarily. I don't like mentioning names of brand. So I'll say spread for bread and stuff, and also noodles. If you can just, give us more information on what we can replace with, if that is not good enough. Thank you.
Okay, so what I would like to say first is the content of any spread you are giving matters. Every parent should try to go through what the content of what they are giving their child is. Like for Bama, I know that it has soya beans, it has oil, it has egg, it has vinegar, sugar, and salt. So I know most of the spread, that's what they have. And some have vitamin E and then vitamin K also in them. But we can't, it's not something we should be giving to them every time. It's not something we should be giving, encouraging every time. Once a week, that's not bad, but not something because you're tired or something. Okay, go and get bread and apply spread on. No. And we know our children, they put a lot on their bread. You can see it and you'll be like, is this the only thing you are eating? So we should encourage them not to take it too frequent, and the quantity also should be reduced. It should be reduced because some of them actually have some vitamins.
All right. Does the same go for noodles?
Well, noodles, I think the reason why people don't really like noodles because of the spices. It's salty and it's a processed food. It's a
Mm,
processed food which encourage we can't encourage children to eat processed food. So we are trying to make them eat more of the natural foods than a processed food. So
all right.
we try to encourage processed food and encourage organic foods.
Okay.
Yes.
All right. Thank you. In the developmental age for children, is it advisable for a child to be a vegetarian? They don't eat meat, fish, and less than 16-year-old. If What advice would you have for such parents that a child refuses to eat all kind of things and says, I'm a vegetarian? Or is there something they can replace to also balance, what they need in their body?
Okay. Well, the reason why most children don't like eating animals is because they believe it's animal cruelty. So they'll tell you that because you're killing the animal, you don't want. But there are other sorts of protein that are gotten from animals. You don't need to, it's not only meat, fish that you get your protein from. You can get from beans, you can get from soya, you can get from the other sources of protein. But we should still try as much as possible to encourage them, because for children, for growing children, they still need fat. So try as much as possible to get a fatty, like they can eat egg. It's okay. It's not an animal. It's a protein also. So there are other sources. There are other means of getting their protein apart from eating meat, fish, chickens. So they can go for the eggs, the beans, the soya, um, the other ones. Okay, there are several ones they can opt for actually. Getting
Okay, but
yogurt.
it doesn't affect their growing or their health in any form.
If they are not getting adequate protein, it affects them. They can't just be eating only vegetables. They need fats.
Mm,
They need oil in their food also. So, but you
okay.
just have to know the quantity you are giving. If they don't want to take the animal, there are other means of getting animal
The
protein.
fat that they
Like I said,
need. Mm.
yes.
All
So,
right. Thank you so much. Thank you so much, Dr. Falabi. Thank you. All right. So I'm back to Dr. Akbe, where another question for you is it very useful to use BMI to define obesity?
Okay, well, that question, there's been a lot of controversy around it because the bodybuilders have more, their weight may be increased because they are building muscle. So not necessarily that they are obese. And then there are some races that have more muscle, like the Chinese, and there are some the Asian people that have more muscle in comparison to fat. So their own BMI chart is even different. So apart from the BMI, we also have how we measure the fats. Like there's a machine called the bioimpedance machine. That bioimpedance machine can measure fats, and there are others, the DEXA scan and all that. There are other ways, but BMI is somehow universal, standardized, and all. And then, if you look at in terms of complications of obesity, those higher BMIs, people that have BMI from 30 tends to have some of those complications of obesity. So it's not something we can throw away because the BMI as a screening tool, there are some faults here and there, especially because of muscle mass. If a bodybuilder stands on the scale, he might have a BMI of more than 30, but if you look at him, he doesn't look obese. So there are other ways to go around it, but generally, studies have shown that when people have increased body mass index, they tend to have complications. So we can look at it both sides. Like I'm a doctor, if I see a patient and the patient his BMI is 35, is coming to me with symptoms of diabetes, hypertension, I would know that that BMI is working correctly for this patient. Or if I see a bodybuilder, his BMI is 35, but he doesn't have any side effect, any complications of obesity, I'll say, okay, this might be one of the people that I will not rely on BMI for. You understand?
Mm,
So yeah, so there's that disparity, and then even the BMI chart we have for the Asians different because their own body build is different. So it's a useful tool, but it has its shortcomings.
okay. All right. Thank you very much. I'm going to take Dr. Obodo's question, and then I will direct everyone else to go um, consult with you virtually on the TeleDoc app, because we still do have a couple of
Lot of
questions.
questions. Please,
Yeah, so
can I beg to run, please?
yes. All right.
Very
Permission to run to your party. All right.
Thank
Thank
you
you
very
so
much.
very much,
Thank
Dr. Okwewe.
you.
Thank you so much for being available today despite your busy schedule. We're so grateful. Thank you. And we will direct more questions to you via the TeleDoc app. Permission to fall out, ma. Thank you very much.
Thank you.
Looks like
Goodbye,
Dr. Afolabi is dressed as well. Is she
everyone.
ready to is she ready to step out as well? I mean, we're rounding up in like 4 minutes. So
Okay.
yeah, so I'm just gonna round up now. Let me just take we have a couple of questions, but let me just take the one on PCOS that I saw because it aligns with what Dr. Obodo talked about. Dr. Kingsley, please, what are the chances of a woman with polycystic ovarian syndrome to conceive?
Okay, what are the chances of a PCOS woman to conceive? Now, PCOS we know is an endocrine disorder that at least affects the ovary. That you're not having more of the male hormones than the female hormones. So ultimately, what they have with PCOS is either they have irregular cycle or they don't even menstruate at all. Okay. Now, for those who have irregular cycles, if there are no other impediments to conception, either the tubes are patent, there's no male factor, there's no other issue, such women can still conceive naturally without any assistance. So you find out that people, what PCOS does is that we know that menstruation occurs every month. So rather than
Hmm.
menstruating probably like 12 times in a month, a PCOS lady can probably menstruate like 4 times in a month, in a year, sorry, 12 times in a year. A PCOS woman can probably menstruate like 4 times in a year. But at times, even in that menstruation, where there are release of oods, at times pregnancy still occurs. But that being said, where there are obvious anovulatory factors and you've excluded the other factors, simply placing them on ovulation stimulation can also help them to achieve conception naturally. Okay. And we've talked about number one, for people who are obese, can help even in losing weight, dietary regulations and all that. Then with the use of ovulation stimulation drugs, yes, they can still get pregnant naturally. Okay, so they can still get pregnant. So it's not as if people who have PCOS don't get pregnant. They can still get pregnant. But the issue with PCOS, there are three things with PCOS, two things basically in terms of gynecological that affect this. Either they have irregular cycles and they have irregular menstruation or no menstruation, no ovulation at all. So once one is able to exclude our factors, then yes, you can still get pregnant, but you must follow the lay down modalities, ensuring that there are no other impediments to
Okay.
ovulation. Apart from
All right.
ovulation, that's the issue. Yeah.
Thank you very much. I was going to end with that question because we do have a lot, but I saw that I omitted this particular one. It was sent earlier, and the person wrote a message again and said, "You have omitted." Yes, so I apologize for that. Can a woman without egg menstruate? And that would be my last question. If you're just joining or you just dropped your question, I apologize. We're to round up this by 12, and we're 10 minutes ahead of our time. So I'll just let Dr. Bodo take this question on egg menstruation, and everyone can download the TeleDoc app to book a consultation one-on-one with Dr. Obodo. The link will be shared to everyone, and you can also get the link in the bio on TeleDoc app. Dr. Obodo, please take the question. Thank you.
Well, I don't. Maybe I will try and reframe the question. I hope that's what the person who is asking. Can a woman without egg? Is it the eggs? Is it the ovaries? Can a woman without ovary menstruate, or the woman who without eggs menstruate? So the question is a bit confusing, but let me try and reframe it or probably yes. A woman, we know that basically menstruation, the act of menstruation is there are hormones, that interplay of hormones that acts from the hypothalamus to the anterior pituitary gland down to the ovaries, that releases certain hormones. Basically, the hormones, we have the FSH, follicle stimulating hormone, and the LH. So it is the interplay of this hormone coupled with your estrogen and all that that leads to ultimately to and progesterone to menstruation. Now, where there are no ovaries, of course, it is not possible that a woman without ovaries to menstruate. That woman will have primary amenorrhea. Now, going down to the flip side, to the extreme, people who probably, as a result of increasing age, once the ovarian reserve, there's what they call before. There are three stages within the woman, women generally. You have the stage of reproductive phase. Then you now have the menopausal stage. Then in between the menopausal stage, where it's like a ladder, you have what they call the climacteric phase. This is at the phase where the period becomes, there's a transition between the phase of reproductive phase to the stage of menopause, where everything has stopped working. That means the ovaries are not functional. So once the ovary stops functional, there won't be release of some of these hormones naturally that will now bring about menstruation. So in that way, a woman who has gotten to that stage will not see her period. But yet you can still induce period if you provide exogenous progesterone, estrogen to that woman. That woman can still see her period, but only if you provide exogenous. That means externally, those ones that have been you give orally or can still make the woman to menstruate. But naturally, a woman without when the ovaries have let me say have stopped working, will not be able to see her period. And unfortunately, the ovaries are not responsive to hormonal manipulations like the uterus. Okay, but so
Right.
once the ovaries have shut down, yes, the woman will not be able to menstruate naturally. But again, if you provide hormonal external hormones to that woman, because the uterus is responsive to hormonal manipulation, that woman can still see her period. I hope I've answered your question.
All right. Thank you so much, Dr. Obodo. I believe that some questions are personal, and because you need to ask more questions to be able to give accurate information. But yes, thank you for rephrasing the question, and I'm hoping that that is helpful. Like I said, we do have a lot of questions. Dr. Afolabi, is it advisable for children to take caffeine? I think I'm going to take that last question because you're still here. Is it advisable for children to take coffee? And if yes, what at what level is that question? And that will be the last question for you. Thank you.
Okay, so it's not advisable for children to take caffeine because most time we see in them that they start having palpitations. That's their heart beating so far. It happens to adults too, but it's more pronounced in them. So we don't encourage them to take caffeine at all.
Okay. All right. Thank you so very much, Dr. Afolabi, Dr. Kingsley, Dr. Akpeweb, Dr. Pradip. I am so grateful for the gift of you all. Thank you for sharing. So vulnerable. Thank you for giving us from your wealth of experience. We know that this is not cheap to have you here. We know how it is. Your time is so precious, and you have decided to give back to the community by giving us a free consultation and talking to experts like yours. We're grateful. To everyone watching, if you'd like to consult one-on-one with our doctors, which I advise so that you can, share one-on-one information, you can download the TeleDoc app. You can find all of the doctors on the TeleDoc app. Book for your consultation. Their time slots are open. Book the time that works for you from the comfort of your home or office or car or wherever you are. you can actually consult with them. Dr. Bodo, if you have any parting words, you can share with us. Dr. Afolabi, if you have any parting words as well, I think I'll take Dr. Afolabi first so that I can let her go because she's all dressed up as well. So I don't want to take all your Saturday. So just give us a 1-minute parting words if you'd like to say anything, and then I'll take that from Dr. Bodo, and then that will be the end. Thank you.
Okay. Well, what I would just advise others and every other person is what we eat. What we eat determines our health, and healthy living is very, very important and crucial to our well-being. So we should try as much as possible to feed our children appropriately, and with that, their immune system is covered, their milestone is covered. So let's just try as much as possible. It's not easy, but it's something that is doable, and we can achieve a healthy child and healthy living. Thank you.
All right. Thank you so much, Dr. Afolabi. I'm so grateful. Thank you for your time. We hope that when we call you again, you would oblige us. We appreciate your time.
Sure.
Thank you so much. All right. Over
Thank
to
you.
you, Dr. Obodo. Okay, thank you.
Okay. Thank you. Well, once again, thank you for having me. It's been a very enlightening presentations. I just want to say that for women, prioritize your health. Don't self-medicate. Don't assume diagnosis. Don't take advices from your fellow. No two fingers are the same. Your symptoms may be different. Your presentation may be different from the next person. So do not assume. Always seek health expert advice and in all issues that relate to your reproductive health, and you're on the way to a fruitful and reproductive journey. Once again, thank you very much for having me. Thank you.
Thank you so much, Dr. Obodo. Thank you. We really appreciate you for your time and for sharing with us. And you do have a lot of questions waiting. So I just want to recommend and advise everyone, please download the TeleDoc app. They will drop the IG. On IG is at TeleDoc app, TeleDoc app. We'll drop that now so that you can click the link in our story and in our bio. It will take you there and you can consult directly with Dr. Obodo. There's only so much we can do in 2 hours, but I'm glad that they've been able to answer a couple of questions. I know you still have more burning questions, so make sure you go download the TeleDoc app. If you click the link to the specific doctor you want to talk to, it will take you directly to their handle, to their link, their page, so you can consult directly with them. Thank you so much. Thank you, Dr. Obodo. I really appreciate you. The entire TeleDoc team says a very big thank you for always obliging us when we call you. We are very, very grateful. Do enjoy the rest of your day. All right, guys. So, that has been amazing, amazing, amazing. And in case you're just joining us, you don't know everything about TeleDoc, I'm just going to use 1 minute to let you get more information about TeleDoc. Please drop the video so we can know more about TeleDoc. Thank you. Okay, it looks like the video is not coming up. I am still waiting for.
I just spent hours at the hospital waiting to see a doctor. Let me ask you a question. Would you rather put on your clothes when you're feeling sick, enter traffic, spend money on transportation, and still wait in line to see a doctor? Or would you rather conveniently pick up your phone, book an appointment with that same doctor specialist from the UK, US, Canada, Nigeria, or anywhere in the world, all from the comfort of your home for as low as 2,000 to 10,000 naira? Of course you would. And with TeleDoc, that's exactly what you get. You don't have to waste time, money, or even leave your bed when you're feeling sick. All you have to do is 1. Download the TeleDoc app from the App Store or Google Play Store. 2. Sign up and create your profile. 3. Select the type of doctor or specialist you need. 4. Book a consultation at your preferred time. 5. Connect via video call to discuss your symptoms and receive a diagnosis. And finally, get prescriptions, referrals, and expert medical advice all through your phone. That's it. That's all. No long waiting queues, no next appointment stress, no unnecessary expenses. It's fast, it's easy, and it's affordable. Download TeleDoc today and take control of your health from the comforts of your home.
All right, download the TeleDoc app today and experience the comfort and virtual consultation from the comfort of your home. TeleDoc has made it easy for you to bridge the gap. No long waiting time, no traffic, no coming to a particular state or country before you can actually consult virtually with your favorite doctor. Like we said, we have over 600 doctors on the app from various specialties, from gynae to pediatrician to lifestyle coach. We have different doctors, surgeons, we have people. Trust me. You just have to go download the TeleDoc app, join the over 3,000 clients that has downloaded the TeleDoc app, consulting with their doctor from the comfort of their home. You have a question, you have more information you want to get, the doctors are available to consult with you. I'd like to say a very big thank you for letting you join. But before you go, I just want you to know that we have a giveaway that we're giving as a TeleDoc Foundation. We're trying to give back to the society because we believe that everyone deserves a chance to good health. And we know that money also has become part of a constraint. And so TeleDoc Foundation has a giveaway plan. And I'm just going to drop that video so that if you know anyone who can benefit from this, please do share the video. It's on our social media page. Share the video to as many people as possible who need this. Here it is. Okay, so while we're waiting for the video to drop, it is very, very important that you follow us on social media. Please do follow us on social media. We intend to have such webinars, free health consultation on a regular basis to give you more information, to give you more virtual consultation, to give you access to talk to experts every now and then. So please follow us on Instagram, download the TeleDoc app. You can download it on your Google Play or your iOS. It's right there. It's very, very simple. It's customer friendly. It's very easy for you to walk through the app, and you can always browse through to see all the doctors that we have on the app. We have lots of doctors. So any specialty that you're looking for, we have doctors from Nigeria, we have doctors from outside Nigeria on the app. And so you can always consult with even your doctors that have jackpot. They are on the app. If you have jackpot, you can still consult with your doctors from anywhere in the world. So the video is ready. I'm just going to drop it now. Let's go. All right, I'm trying to get it to play. I don't know why. Anyways, the video is on our social media as well. So we would do well to send you the link so that you can get to see the giveaway. We're giving 10 families 100,000 naira each. That is 1 million naira giveaway towards their health. It might be for you, your family members, somebody you know. Please let them access this giveaway. It's totally free and it's towards health. It is very important that this is used towards health. So there are terms and conditions for things to do for you to have access. And 1 million naira giveaway. Yes, you heard that right. Hi everyone, I am Kiki Okewale. CEO of TeleDoc app, and I am so excited to announce a unique opportunity to support individuals and families in need of healthcare assistance. As part of our commitment to giving back to the community, we are launching what we call the TeleDoc Healthcare Support Giveaway. We'll be giving away a total of 100,000 naira each to 10 lucky individuals or families to help cover their healthcare needs, whether it's for surgery, specialist consultation, or treatment for yourself, for your child, for a family member, or a loved one. We want to help. Our goal is to alleviate some of the financial burdens associated with healthcare, ensuring that everyone has access to quality medical attention when they need it most. To participate, download the TeleDoc app on iOS or Android phone, and then follow our social media page at TeleDoc app and post the challenge flyer on your page. Then upload a dynamic 1-minute video explaining your healthcare needs or those of a family member and how these funds would help. Other opportunities are coming as well. Don't forget to collaborate this video with our Instagram page at TeleDoc app. Use the hashtag TeleDoc app, hashtag TeleDoc Healthcare Support 2025. Deadline for submission. Our team will then review all entries and select 10 winners based on their stories. Don't miss this chance to receive support for your healthcare needs or that of a loved one. Apply now and share this with those who may benefit from this giveaway. Tell a friend to tell a friend to tell a friend that you know needs this support. All the best.
All right. So that is that on that information. Even if you don't need it, you might know someone who definitely needs it. Please go on our social media on Instagram TeleDoc as seen on the screen. Please follow us. The video is right there. Share it to your story. Share it to as many people as you know needs that information. That amount of money might just be something that would save a life. All right, so please do not hold the information. Share it as much as possible. On behalf of the TeleDoc team, I'd like to say a very big thank you for joining this program. Thank you so very much. If you came in late, you can always catch a replay. The link to the replay will be shared as well. Don't forget to download the TeleDoc app, find your favorite doctor there, and have your virtual consultation done. Thank you so much for joining. We hope that, as many times as we intend to give you the opportunity to ask the expert free questions, we hope that you will take it, because your body is actually where you live in, like I said earlier. Your body is important and you need to take good care of your health, all right? Like they say, life is for the living. So make sure you take care of your health so that you can keep living a healthy life. Till we meet again, make sure you stay safe, make sure you stay blessed, and make sure you stay healthy. We look forward to connecting you with a doctor that you need to get more information on your health. Take care of yourself and enjoy your weekend. Thank you and bye.